what is generate solutions? Well, basically, you have to think about what nursing interventions you can do to help with the most priority problem described in the scenario. So after identifying the client's priority, giving in the scenario, you want to think about all the possible actions that can be used to resolve or manage the problem. Now, let's switch gears here. So let's say that the clinical case, the scenario was about a patient with difficulty breathing. You got to say, well, what can I do to help a patient with difficulty breathing? Elevate the head of the bed, administer oxygen with let's say a face mask, high flow oxygen. But what if they tell you that the patient arrived unresponsive via EMS, the patient is in respiratory distress, severe hypoxemia, low pressure of oxygen? You have to generate solutions. What could be? Well, this patient is unresponsive. This patient needs priority or immediate intubation. We have to think about possible CPR. Does the patient have a pulse now? Did something change? What can you do? Do I need to call the rapid response team or the code blue, depending if the patient has a pulse or not, depending on how the scenario progresses? But you have to start thinking on generating interventions, nursing interventions to assist with the patient's problem. Or the patient came with sepsis and has severe hypotension. What is the priority nursing action there? Well, then you will be thinking about administration of fluids, administration of vasopressors, administration of antibiotics if it's sepsis. So the prioritization will change depending on how the clinical scenario was developed. Remember, to generate solutions, you need to prioritize client needs. So prioritization is still important for the next generation NCLEX. If anybody else told you otherwise, they lied to you. If somebody told you that you only need to worry about content for next generation NCLEX, they lied to you and stole your money. Because next generation NCLEX is really going to be about prioritization, about really understanding what is going on with your patient. Because guess what? That is what happens during real life scenarios. That is what will happen to you when you go first on shift. You're gonna take care of your patient, and they tell you, run your patient in 310. Oxygen is very low. What are you gonna do? So once you generate a solution, you think about possible nursing actions that you can take. Well, it's time to take those specific actions. Decide which action you will implement first, how you will implement those actions. So you need to determine the most appropriate intervention or combinations of interventions that will resolve or manage the client's priority health problem. So when you're deciding to take action, listen to this, good tip from Linda Saunders, avoid memorizing textbook methods and procedures. Instead, customize your actions to meet the needs of the client in the clinical scenario. What is this saying right here? Forget about memorizing nursing content. reading a book and memorizing everything and thinking that you're going to do great on the NCLEX. No. This is a good tip right here. It's not about memorization. It's about understanding. So now you really need to be strong in both content, but even stronger in critical thinking. Because guess what? You will never find an answer in a book. You're not going to find answers to these case studies and critical thinking studies in a book. You're not going to find it. Why? Because it all depends on how the scenario is described. And lastly, evaluation of outcomes. The last clinical judgment thinking skill is to determine if everything you did was successful. If your nursing interventions help the patient. And how do you do that? Well, very simple. The best way to determine this is to compare what your original plan was. Example, patient with difficulty breathing, let me give oxygen, and then looking at the O2 saturation and saying, oh wow, it went up. So the O2 saturation was 89, now it's 94. Oh, great. My nursing intervention was the correct one. Or the patient was in pain and you gave pain medication or whatever. So you need to ask yourself, which assessment findings or signs and symptoms indicate that the condition improved? Oh, wait till you see these type of questions. Very difficult questions in case studies, but very interesting. I'm passionate about this next generation NCLEX. To be honest with you, I like it even more than the NCLEX now. I think that now they're really going to test the abilities of a nurse to take care of a patient. Some nurses ask me, is it going to be more difficult? I don't think it's going to be more difficult. I think it's more balanced. And also, since the analysis on your answers or the way they're going to look at your answers is a little bit more fair. Since you have partial credit, partial points, so that's going to help out as well. So it's gonna balance out. Right, everything you've mentioned here, I think I heard about it somewhere. Yes, you did. You've heard about this. This is nothing new. Where did you hear about this? Well, first in nursing school, I hope. You know the nursing process, right? The famous ADP, assessment, diagnosis, planning, implementations or interventions, and evaluations, right? Same thing here. But now they have put this together in a clinical scenario, and they ask you in different style of questions, whether it is a case study or not a case study. They're gonna have you really put everything together. Nursing content with clinical judgment. And in a few slides, this is what Next Generation NCLEX is.